Hi guys.
Hello. How's it going?
I'm the nurse taking care of Mr. Johnson, and he just gave me a call and told me he wasn't feeling very good all of a sudden.
Okay. What's been going on?
Well, I just all of a sudden felt really short of breath.
What is he here in the hospital for exactly?
So he was admitted yesterday because he had influenza. He's had a cough for 3 days, and he's just been feeling really weak. So he was working with physical therapy today, and they called us and told us he was really short of breath all of a sudden.
Do you have his current vital signs?
Louder? I think. Can you ask Marquise if we can get it louder in there? All right.
Can we have his current vital signs?
Well, we'll have to get him hooked up to the monitor first. So if you guys want, I'll work on getting a blood pressure. So
sure.
I'll put the blood pressure cuff on and we'll get him hooked up to the monitor. And this is what his monitor looks like.
Is there anything else you guys want?
Blood sugars. What's the breathing rate? Is it
More usually the heart rate and the respiratory rate. Vital signs essentially.
Is it
Let's see
oxygen?
what it looks like.
All right, there's your monitor. So his blood pressure right now is 145/93. His respiratory rate is 20. His temperature this morning was 38.5, and he's 92% on room air with a heart rate of 170.
Is he aware?
Yes, he's talking to you.
Any past medical history?
He has a history of high blood pressure.
And right now, is he feeling palpitation or sinking heart feeling?
He is feeling like his heart is racing and that he's having some shortness of breath.
No dizziness.
No dizziness.
Okay. So 170 is
So it's an SVT.
Yeah.
Do we have IV access?
We have one IV working and the right AC.
Can you do the vagal maneuver?
Yep, we can try that. I would have someone in the room do that if you can. Okay.
Shall we step back and assign roles real fast too?
Sure.
Okay.
So you're expecting something that's going to
So
happen.
residents, you need to talk louder. We can
Okay.
hear you.
Okay.
very well, but residents
Be
talk
really
louder.
loud.
Okay. Talk loud. Shout.
Okay.
I want to find the lower problems.
Did his heart rate go down?
No, his heart rate did not change with vagal maneuvers.
Okay.
So we can try a dose of adenosine next.
Okay. So if you want, you can get an EKG and it will look like this.
Okay.
So take a good look at your monitor.
Mm-hmm.
So you want to do 6 of adenosine?
There's no asthma, right? No history of asthma?
No.
Okay, it is innocent. We can go through that.
Okay, so we gave a dose of adenosine and nothing happened.
Repeat again.
Yeah.
What?
And we,
Repeat again. Adenosine 12.
Adenosine 12? Alright.
It's like AFib.
This looks more like AFib than
And his blood pressure is still one.
Still 140s.
Yep, right now, still 140.
metoprolol. You're gonna get
Bolus diltiazem on the total.
Okay, who's gonna do that? Someone assigned to
I
give
can-
me-
I can do it.
You wanna
Okay.
give him
Yep.
this?
Are the meds over here?
You can just pretend.
Okay. I will draw up. How much diltiazem would you like me to give?
I wanted to give you like 10 milligram of the metoprolol.
Okay, I can do 10 milligrams of metoprolol. Okay, I'm drawing it up and I'm giving it. 10 milligrams given.
Any change?
Oh, I really don't feel very good. I'm starting to feel really sick to my stomach and I'm getting really, really dizzy.
What's the blood pressure? Can we repeat?
The blood pressure is 92/54.
What's the heart rate now?
The heart rate's still 170.
Mm.
Oh, I don't
What
feel
is
good.
the
If
IV
his-
access?
If his blood pressure is dropping, we should consider doing a synchronized cardioversion on him.
If he's still in AFib.
If he's still, right.
Yep, so EKG is unchanged.
Okay.
So then, do we want to get all the
Yeah.
materials ready?
Okay. What do
And
you
hook
need?
them up to
Cardioversion,
the.
the paddles.
Okay, so these are your paddles. They just clip onto his chest. This side. Oh, and can you help them with
Actually, you think I'll come off?
that? Maybe. Yep.
Okay.
Is there
You don't have to plug this in or just leave it as is.
Yep.
Alright, the pads are attached and working.
Make it synchronized.
Yeah.
Okay,
Let's see.
so when it's like this, we can't change it, but you would just turn it to synchronize. Somewhere on here, sync on. So sync now,
Yep.
okay? And you know, cause you have your arrows,
Gotcha.
okay?
What do you want me to set it to?
100.
Say it again, how much do you want?
100 Gerald, we started at,
Isn't it usually,
6.
100, we just start 100 and then go up.
Okay, I'm setting to 100 joules.
200 ours, but okay.
Alrighty, is that okay?
Yep. Charge it up.
Okay, I'm gonna go ahead and charge. Alright, is
Are we
everybody
clear?
Sure it's clear.
Yep, delivering shock, and shock delivered.
Still.
So it's braking. Sinus.
Yep, that looks like a normal
Yeah.
sinus rhythm now.
How are you feeling, sir? You still awake?
I'm still awake. My chest kind of hurts after that shock, but I feel a lot better. My heart isn't racing and I'm not short of breath anymore.
I want to see the blood pressure right now.
The blood pressure now is 120/80.
Okay.
And I want to start heparin infusion. I want to take cardiology on board.
Okay, we'll call cardiology.
And we'll do echocardiogram tomorrow.
Sounds great. It sounds like a bunch of inpatient
Wonderful.
orders.
Yep.
All right, we'll get that stuff set up and we'll
We'll
give you
keep
guys a
monitoring.
call if he needs anything else. All right. Thank you for coming so quickly.
Thank you.
Thank you.
All right, you guys can head back to the room and we'll debrief in there.
All right.
Thanks. All right. This is case 2. It's all right. Hello.
Yeah.
do your code blues sound like?
What?
What's your code blues sound like?
Code blue, room 23, no room 24, and no
Okay.
room 27. That's what they call it. Room.
All right.
I'm going to do just here until here. That's just
All right. Code blue, room 25. Code blue, room 25. Think that's loud enough?
Came in and he didn't have a pulse. I don't know what's going
No
on.
pulse, check
Needs some help.
pulse,
No
no
pulse.
pulse, continue compression.
I'll take over for
Please
you.
switch compressions
Yep.
here.
Count down.
Can you take care of the airway, please? You have IV access?
We have one IV in the right AC.
Can we check IV access is working,
I'll
please?
check your IV access.
Thank you.
Salver, do you wanna be at the foot of the bed?
Are you team lead?
Yep, I will be the team leader, okay?
Are you ready?
Thank you, everyone.
Working?
Lauren, keep it the step underneath the phone.
What happened, folks? Can you tell me, please?
So this patient was just admitted for like osteo. I came into the room, we found him laying on the ground. I don't know what happened.
Kim was what? I'm sorry.
He was here because he has an infection in his
Infection.
foot. Yeah.
Have you check his monitor, please?
Yeah.
He's not on a monitor right this second.
Do you have
Want us to
everything?
get him on the monitor?
Yep. Please.
Are we pausing compressions to give breaths?
Can you switch compression with him?
Yes.
Thank you.
Who's gonna take
Let me know
over?
when you're ready.
Alright. 5, 4, 3, 2, 1.
Switch.
Want him on the monitor?
Check pulse.
You have no pulse.
Alright.
Okay.
He's on the monitor now?
Yep. Can we check the monitor?
I think so.
You have to go to defib. And then
Continue.
So is this accurate?
that is
Yes.
accurate. Yeah.
So.
Can we check the monitor, please?
That's correct.
The
That's what it
monitor
looks
is there.
That's right.
Okay. Check pulse.
You
No.
have no pulse.
No, but continue compression, please. Do you have the IV access working?
Yep, your IV access is working.
Can prepare 1 milligram of adrenaline. I'm sorry.
Say that one more
1
time.
milligram of adrenaline IV.
Okay, I'll pull up a milligram of epinephrine. 30.
Okay.
When do you want me to give it?
I will tell you. Yes.
Okay, I'm ready.
When we switch compression.
Let
Okay.
me know when you're ready.
Thank you.
Count down.
We switch compression.
How long have you guys
Can we
been
give that
doing
in-
compression?
How long?
2 minutes and 2 minutes.
1 milligram
How
of
do you know?
epinephrine and the IV.
Salver, do
Maybe
you want me to
time?
keep time?
Yeah, can you please check the time?
Yeah. Okay.
Okay.
Thank
And
you.
I'm also documenting.
Thank
So
you.
we've had 2
27,
minutes of
28, 29,
compressions.
30.
Okay.
Can we go with advanced airway?
Yep.
Yeah, it's okay.
You can successfully.
Okay. Yeah, successfully intubated. Thank you.
Okay.
Did we get the epinephrine?
Yeah, I already gave it, yeah.
Cool.
2 minutes past.
Very sure. Verify. No, not 2 minutes yet. We're like 3 minutes in now.
Okay, this patient came with osteomyelitis and then he arrested suddenly. We are just checking what may be causing that. So we check the 4H and 4Ts. No history of hypoglycemia before this.
Nope.
No hypoxia, he was not on any oxygen.
He does not have any oxygen.
No hypothermia.
Nope. Temperature was normal today.
Okay, any change in his electrolytes? Potassium was low or high?
Nope, it was all normal this morning on his labs.
Any, we suspect any tamponading or any tension in thorax?
I don't know, do you suspect that?
Lauren, you're just
Can we get an echo and check bedside one?
5,
we
4,
can't find
3, 2, 1. Switch.
2 minutes.
You
Check
can,
pulse,
You can do it.
check monitor.
No pulse.
Still no pulse.
Okay, continue compression.
Okay, it's been 4 minutes since the start of compression.
Yep. When was last time we gave epinephrine?
We gave it at 2 minutes.
Okay, can you prepare 1 milligram of epinephrine for
I'll
the
go
next
ahead and
switch,
pull up
please?
another milligram.
Thank you. Can we check ABG and labs, please, for him?
We can do an ABG. He has a potassium of 6.8, or sorry, a a pH of 6.8 on his ABG, and then labs are pending.
Don't worry about it.
Okay.
Okay, can we prepare IV sodium bicarb, please?
Yeah.
50 equivalent.
Sure.
Okay.
I'll give a second. Sodium bicarb.
You can give.
Okay, I'm gonna go ahead and give 50 milligrams of sodium bicarb through the IV.
Thank you.
Pushed.
It's been 5 minutes since start of compression.
Okay. Again, I listen to his lungs.
Yeah, bilateral movement, no concern for tension, pneumothorax.
Okay, continue compression. Thank you.
What's his volume there?
What do you think, guys, may be going on? We have checked the alt H's, alt
What kind of
T's.
medications does this patient get?
He's on lisinopril, Acrovant, metformin, and he's getting vancomycin for his infection.
Does it mean no allergies?
No allergies.
Well, discontinue the vancomycin. Is it vancomycin running right now?
No,
Okay.
he got it this morning.
This morning, okay. Is he getting any medications right now continuously?
Nope.
Okay. Look at his skin, any signs of
It's been 6 minutes since.
Okay,
anaphylaxis?
Will Chef, can you give the epinephrine?
Yep.
Please.
Giving.
So
Okay,
I
check
heard-
pulse. Check pulse, please.
Any pulse?
No pulse.
Check the monitor.
Giving 1 milligram of epinephrine in the right IV.
We got nothing about.
Um,
How many rounds of epi have we given?
We've given 2.
do we have the labs back yet?
No, labs haven't come back yet.
No, not yet. We gave epi at 6 minutes and it's been 1 minute into this compression cycle.
Have we done a bedside ultrasound?
You can do a bedside ultrasound at your next pulse check. We were able to find one down the hallway.
Okay, good.
We can check a pulse now if you want.
Okay, let's check.
Check
8
pulse.
minutes.
Check
So
monitor.
no pulse is present. You do a bedside ultrasound and you see no cardiac activity. Like nothing on the ultrasound.
You mean not tamponade as well?
No tamponade,
Okay, yeah, continue.
no cardiac activity.
Continue compression, please. 60 wearing. And can you prepare 1 milligram of epinephrine, please,
Yep.
for the next stretch?
I'll drop 1 milligram of epinephrine.
Yep. And what do you think, guys, we may be missing? Any ideas? We checked the H's, MTs, and he doesn't have any history of drug intake, any
Nope.
history of toxins intake, no.
Nope.
Have we administered anything other than the epinephrine?
No, what do you
You
think?
gave
What should we?
bicarb, right?
We could
Yeah.
just
You did give a dose of bicarb.
Yeah.
empirically give calcium gluconate.
I mean, we don't have the labs back yet, and he doesn't have
labs.
any history of hyperkalemia, of any renal disease.
So he's here for infection. Are we concerned about septic shock, right, or anything like
Still
that?
like, it's nothing we can reverse right now. We give the sodium bicarb for the severe acidosis, which he has.
DVT of the lower
Steroids. Steroids consideration for septic shock.
No, he's cardiac arrest. We're not giving stress in arrest.
I was thinking fluids if we're concerned about septic shock. but-
So we can't do a CT angio, but we can look at the labs. Can you see anything wrong
We
with
can
it?
run fluids.
No,
Um,
you can run fluids. There's nothing on his legs on exam. It's been another 2 minutes since your last pulse check.
Can we check pulse?
You do
Check,
not have a pulse.
check monitor, please. No, oh, go ahead. Another one, continue compression, please.
We check,
Give it a bit of
patient active, is the patient full code?
Yep.
I'll go ahead and
The
give
patient
1
is full
milligram of
code,
epinephrine.
but he is 89 years old.
Let's contact family.
What do you guys think about going another round after this? 89 years old.
All right,
Yeah,
2
that's-
minutes since your last pulse check.
How many,
So in total, we've had 12
how many sockets did we
minutes.
have we done?
We've done 3 rounds of epi, 1 round of bicarb.
How many total, can you
And
put
one fluid.
compression,
No
please?
pulse.
No pulse. How many cycles did we do
Oh,
in general?
12, so 6 rounds.
Okay. We will continue to 10 rounds, guys, 20 minutes, and then,
All right,
No,
fast
that's a
forward.
pulse.
You've done 10 rounds.
that's okay. Can we check pulse, check
No.
monitor?
No pulse.
Okay.
That's your monitor.
No reversible cause for now. We have been doing this for 10 cycles, 20 minutes. I don't think we should continue. We are done. We just double check pulse and we declare that.
All right. So time of death.
Yeah.
Timekeeper?
Oh,
Now?
now it's 6:20 a.m. I don't know.
All right, we can go back to the
Always
room.
shift change.
Using a dagger.
Don't worry. We didn't do
It's
anything
89,
wrong.
yeah, don't worry.
Okay,
It's 89.
go ahead. It's the next one.
start compression, please. Can we feel a pulse? Okay.
No pulse.
Okay. No breathing. Okay, start compression. Okay. No more airway. Okay. Plug the monitor. Okay. You have the timer documentation. We have the meds. Can we have 2 IV access, please?
Yes, I will get 2
I'm on meds.
IVs.
Yeah. Plug the monitor, please.
Yeah.
Can we have history what happened to the patient?
I just got called into the room. He said he all of a sudden felt like his heart was racing, and then he went unresponsive. I felt for a pulse, and I didn't feel anything, and that was right when he walked in.
Okay. Continue compression. Okay. We get to IV access,
First
right?
IV is in.
Okay. Timer is here. Documenting everything, please. So what's past history of the patient? What's chronic condition he
So
has?
this guy got admitted yesterday for an end STEMI. He's been just waiting for cardiology to take him to the cath lab. He's been fine until today, and he's just all of a sudden.
Your time.
I got the timer.
Okay.
You're at 50 seconds, Ron.
Okay, good. To IV access, get labs, please.
Getting labs.
So this patient was waiting for heart cath. Likely, maybe he has like a cardiac arrest, MI. Okay, continuous compression. Getting labs done.
Labs are
Okay.
on.
How many minutes now?
We're at 110.
Okay, continue compression. We gotta check. Okay, the monitor is. Okay. It's beat that. We gotta check after 2 minutes. Okay. So we gotta stop after 2 minutes. Check pulse. Okay. So just let me
30
know.
seconds.
Okay.
I'll get Epi ready just in case.
Yeah.
Okay. I don't know where it is.
15 seconds.
We gotta be ready to check pulse after 15 seconds, please.
Do we have access?
Yeah, we have
two
access.
access.
5 seconds.
Okay.
Pulse check.
Stop compression. Pulse check. Monitor.
I don't.
No pulses.
No pulse. What about rhythm?
VTAC.
Okay. Vita, continue. Chest compression. We gonna give EP.
Wait,
Would you like pads on
Would you
the
like
patient?
we already did.
How's
pass.
our patient?
Oh, we got pads.
What would you want to do with you?
No, shock. Yeah.
You're on. So just.
Oh, I already am. Okay.
Just shocking.
Everybody clear?
Shock.
You can charge.
Well, you have to charge.
What do you want to charge to? You're charged to 120.
Okay.
You can deliver
Okay.
a shock at 120.
Stop.
Clear.
So everybody clear.
Clear.
Where?
That and then
Red
shock.
button.
Push the red button. There you go.
Shock delivered.
Okay. Continue chest compression. Okay, we have pulse feedback. We're gonna give EP. 1 milligram EP, please.
I got it. 1 milligram Epi given.
Okay, good. We have to look for reversible causes, 5H and 5Ts. What do you think, guys? Can we get a fast for the patient? Looking for pneumothorax, pericardial effusion, anything?
You don't see anything.
We have
Oh.
the ends right.
Yeah. Okay, so we are thinking about ACS now, and we're gonna consider giving a TPA to the patient. Any thoughts?
We should try to shock inject as well. If he's still in a shockable rhythm.
Yeah. Okay. Continuous compression. How many times now?
We have 1 more minute. 1:15.
Okay.
Are we gonna do
What?
up again or in the other one, or are we gonna?
set to charge to 120.
We're gonna give every other cycle.
1 minute.
Okay. So just we don't have to like focus on one problem. We don't have like tamponade, don't have a pneumothorax. That's not good yet. Looking for toxins.
It just says that your monitor should know.
Okay. What about
So
timing?
I just do what
So
it
that's
says.
30 is 5 seconds.
Okay.
So I do that. Yeah.
20
Just in
seconds.
case.
So we're gonna check pulse after 20 seconds, please.
How much?
Do we have, did anyone else do conversions yet?
No, that's what that. Yep, we can switch.
Oh, you know, yeah.
You're good. You're good. It's just
Okay, pause CPR.
No
Pulse
we
check.
still have
Pulse
VTAC.
check, monitor.
VTAC, should we
VTAC.
shock?
Okay, Chuck.
Every clear.
Clear.
Charge. It has,
I already checked for shock.
Okay, good. Continue chest compression. Can we alternate the chest compression? after this cycle, okay?
I
So
haven't
we
given
give
a
if
second.
yeah, we can give every other cycles. So next cycle, please let us know to give
Oh
another
my God.
EV, okay? So to summarize, we have 2 shocks for the patients. We give 1 EB. Next cycle, we'll give another EB.
30 seconds.
Gonna check pulse after 30 seconds. And the rhythm check. This will be the third.
I'm just charging.
Let us know. Thank you.
15 seconds.
Yeah, I should charge later.
Five seconds. Pause CPR.
No
Pulse check.
No pulse.
No pulse.
No pulse
VTAC.
still, VTAC.
Should I
Okay,
shock?
continue chest compression. Shock, yeah.
Yeah, we should clear.
Okay. Continue chest compression.
Would you like to give another dose of
Yes.
epinephrine?
Yeah. 1 milligram of EB now. Can we prepare
1
amio?
milligram epigiven.
Can we prepare amio 300?
We can.
Okay. Now we have 3 shocks, right?
3 shocks.
Okay. Can
2
we give
doses of epinephrine.
amiodarone 300 milligram IV?
Annie in.
Okay. 300.
Yeah.
Okay. Continue chest compression. Now we have 3 shocks. Okay. We give amio. We give
2 doses of
EB.
epi.
Okay. 2 doses of EB. So I think now we have to consider
30 seconds.
TBA for the patients. Okay. Any thoughts? We can like
Yeah.
Yeah.
okay. We can like call cardiology quickly for TBA.
Okay, 15 seconds.
Okay, we're gonna check pulse after 15 seconds and check rhythm. Can we prepare TBA as well, please?
5 seconds.
I don't know the amount of TPAs in my hand.
Oh,
Stop compressions.
okay, check pulse, rhythm.
No pulse.
You have a pulse.
We have a pulse.
We have a pulse.
We do. Okay, we have a pulse now. Okay.
Alright,
Okay, so
now we need
now-
somebody to.
Rusk has achieved now. Okay.
Yes.
Can we keep the airway?
Oh, and it looks
You're
like
in a
sinus
fish
rhythm.
Okay,
your
so
ICU.
Okay, can we call the ICU fellow, call the
We're getting
cardiology
EKG.
fellow? Okay, get EBG, chest
EKG,
X-ray.
look to see if there's a semi. Everyone's on board after that.
Okay.
Alright.
Okay, we have intratracheal intubation. Okay, we can check vitals again. EKG have checked. Okay.
You guys are so excited. Get out of the case. Alright, good job. We can go back.
Good
Good
team,
job.
good. Dream team.
Thank you, everyone.
wake up. I don't know what's going on. Help!
Oh, do we have a pulse?
No, we don't have a pulse.
Okay, please, Vinay, please start chest compressions now. I want the patient hooked up to our monitors. Who's the nurse?
Starting compressions.
Start compressions, please. Okay.
Let's put the
Islam,
patch.
please change with switch with
Hi, I'm
compressions.
Alice. Do you want me to get on airway?
Yes, please get an airway.
And I can do the meds.
Cash, we
Do you
please
want
get
to
an
lower
IV
your
access and
meds?
we'll
Can you
be doing your
lower your
meds.
And then timekeeper.
You'll be, okay, you'll be
That's
taking,
alright, you can do.
okay.
Okay, IV access in.
Do we want to put on the leads?
I can put on leads as well because we're short on people.
Is someone taking time?
Yeah.
Yeah, she's taking time.
So what's going on?
Can we connect the, is he hooked up to the monitor yet?
Yes,
You don't stop
monitor is
chest
hooked up.
compressions.
Let's see what rhythm we have.
Where's our monitor?
Oh, we actually have to connect it. I'm sorry.
Okay, so, it's a witnessed arrest. What do we know about the patient?
This patient came in, they were feeling, they had an AKI and got admitted for some fluids. I don't know, I just walked into the room. I don't really know much more about him.
Has anyone listened to their heart or lungs? Oh,
I just walked in the room right before you guys.
Okay,
So we know what rhythm it
where is our monitor in the
The
first
monitor's
place?
on the card.
Okay, we don't know what the rhythm is anyways. Okay, post compressions, stop CPR. Okay, continue compressions,
No
please.
pulse.
Let's charge the defibrillator, please.
Charging.
2 minutes.
120. Ready.
Okay, all clear.
Okay, all clear.
I'm clear.
Shock.
Shock.
Deliver shock.
Red button, red button. Red button.
Continue.
Continue compressions.
How many minutes?
How long has it been?
2 minutes.
Okay, can we give him 1 milligram of epi, please?
Even just measure it, so it's fine.
1 milligram epinephrine in.
Okay. Can we draw his labs?
Your chest compressions look kind of slow. Are you getting tired?
Yes, ma'am.
Maybe at the next we can switch. So we're all relaxed. So I'm setting CBC, BMP, magnesium, everything.
Okay.
Okay.
Thank
What
you.
was their potassium this morning?
Potassium has been a little bit high the whole time. They really aren't, their kidneys aren't working, so. I don't know exactly what the number was, but that was what the other nurse told me.
Okay.
How many minutes are we on?
30 seconds left.
So switch out is the next.
So what do we think is happening right now?
I'm sorry?
What do you think what's happening right now? Since he's an AKI, maybe he's going overloaded.
So we have a V-fib arrest. Most likely it could be a combination of his acidosis and his electrolyte imbalances.
2 minutes.
2 minutes.
Or pulse check. Change.
There's still pulses?
No, no pulse. Let's see what's on the monitor. It's
Alright.
still WeFib, so
Continue
charge.
compressions. Charge. Charging. Okay.
Okay, all clear.
Ready. Clear, deliver shock. Continue compressions. Cashby, can we give him 300 milligrams of amiodarone, please?
10 milligrams of amiodarone.
Calcium gluconate, 10 milligrams of calcium gluconate, 4 milligrams of magnesium sulfate.
300 amio given.
Calcium.
Calcium given and magnesium given.
Okay, 1 ample bicarb.
Did you want?
That's 10 milligrams.
Calcium what?
10 seconds left. I'm gonna try and get another IV because that one seems like it's getting better.
IO successful.
I was successful.
Great.
No pulse.
Well, can't check right now. Okay, so 5 H's and 5 T's. So we think he might be hyperkalemic, he might have some acid-based stuff going on.
Okay. It all goes with the AKI, so my thought process is we can have acidosis, hyperkalemia, low QT, might have blood to torsades, That hence the magnesium.
Do you wanna give bicarb?
I thought oh, okay.
Yeah, we
My
can do
bad.
some bicarb.
I thought I said bicarb, but maybe I didn't. Okay, so one
We'll
ample
do some
bicarb, please.
bicarb.
Thanks for reminding me. From the time you.
Bicarb given, 10 seconds left with a nice pulse check.
You can switch this one.
Okay.
We can have someone call the family.
Okay.
I'll work on that.
In the meantime, can we get an ultrasound?
Yep, we'll get the
And do
ultrasound.
insulin.
Thank you.
10 seconds.
Mm-hmm.
Okay.
Alright. So pulse check, no pulse on the monitor, still VFib.
Okay, charge, continue compressions, charge the VFib, please.
Charging.
Ready?
Charge ready. Clear.
Okay. All clear.
Clear.
Deliver the charge.
Shock delivered. Continue. Compressions.
Sodium bicarb given.
Okay, do we have any of the labs?
No, no labs.
Okay. And is he, do we have entitled CO2?
How much time since the last time ago?
Yeah, end title is hooked up and it's 10.
Okay.
Given.
So, okay,
So we could actually do another epi.
sure. Go ahead for it. Go for it.
You can do insulin D50. Hyperkalemia. He was hyperkalemic in the morning.
How hyperkalemic was he? We don't know,
We
right?
don't know
I'll
yet,
get
so
that
we can
going.
do insulin D50.
What do you guys think?
Yeah, sure.
Okay.
Given
do
1 milligram epi.
Okay. Next cycle will be, we need to give the second dose. of
10
Ambien.
seconds air rate. Oh yeah, we have an advanced air rate. Never mind. Pulse check.
Islam, be ready to switch with Vinay. Looks tired.
Okay.
Pulse
Pulse
checks.
What's the
check.
patient's blood pressure
We don't
right
know.
now?
No blood pressure.
We don't
no
have a
pulse.
pulse.
No
Oh,
pulse.
okay,
Do
charge.
you wanna get fluid?
Continue compressions, continue compressions.
Fluid.
Let's
His
charge.
volume or
Second
fluid.
charge. Okay, thank you.
With his ESRD. I mean,
Charge,
he's
okay.
fluid.
Clear. Shock ready, clear.
Clear.
Deliver. Shock delivered. Continue compressions. Let's give the second dose of amio. Casualty, please. 150 milligrams of amio IV.
Okay. 150 milligrams a amio, getting ready. You're doing a great job
Okay.
with your chest compression. Okay, 150 amio given.
We're gonna treat them empirically for hyperkalemia. Let's give him some insulin D50.
Okay. Given 10 units of insulin, and I'm giving him some D50.
Do you want to switch? You're getting tired.
10 seconds. 10 seconds.
Okay, can I get ready to take over? Islam looks tired.
You want to analyze?
Everyone is tired today?
How many, so you said 10 seconds? Okay.
Okay. Done?
Okay, pulse check.
Any
You do
lab work?
feel a pulse.
Okay.
Oh, we got the pulse.
Alright, we got a pulse.
Okay.
So what's his blood pressure?
It's like 80 over 40.
80 over 40. Did we get any of our labs back?
No.
Okay.
Okay, the patient is intubated, right?
Yeah,
This-
he's
I'm dealing with
intubated.
this as if
Yep.
it's you.
Into
Yeah,
the-
yeah.
Okay.
Intubated.
Okay, so
Yeah.
the patient needs to go to the ICU, put a central line, an orth line, start pressures.
Fluids.
We can give him a shot of phenylephrine now and 500 milliliter bolus until we get the ultrasound and know what's his fluid status and how his heart is doing.
Okay.
Sounds good.
Okay.
I don't know what happened.